music is Gainsborough. Welcome to another edition of Health Matters. I'm Dr. Bruce Karlin for WCCA TV, Worcester District Medical Society, and welcome again. And to welcome our guest, Dr. Alfred DeMaria, who is the former director of infectious disease for Mass Department of Public Health, and just a guru of things infectious disease. For years, he's come out to Worcester many times to educate us. Thanks for being here.
It's great to be with you again.
Well, I love your topic. Your topic is stigma in medicine. Could you define what you mean by stigma?
Yeah, stigma comes from a Greek word, and it refers to branding or tattooing someone to designate them as either being a criminal or a slave or somebody who you don't want to have to deal with, who is not sort of a citizen. So it was a terrible thing then. It's still a terrible thing. We don't brand or tattoo people, but we definitely sort of label people. And that labeling is very destructive to those people and destructive to our efforts in public health and healthcare, because it has all kinds of consequences when people are labeled or even perceived to be labeled as somehow different or undeserving or less than they should be.
Well, the prime example that comes to mind, of course, is the alcoholics of old. We call them sots or any variety of names. And as soon as you do that, the treatment is out the window.
Yeah, no, that's exactly it. When people feel stigmatized, they often internalize that and they start seeing themselves as less and seeing them, their self-esteem goes down. They don't cooperate. There are a large number of studies that show when people are stigmatized or even perceive they're being stigmatized in a healthcare setting, they have worse outcomes. They have worse attendance for appointments. They have worse outcomes in terms of their disease. They have worse outcomes in terms of their adherence to medication. It's a bad thing. And I think, we've come along